Everyone, please welcome cosmetic dentist Dr. Bill Dorfman, pulmonologist Dr. Avi Ashaya, and gastroenterologist Dr. Jorge Rodriguez to the show. And
welcome, docs.
Bill, I want you to address, if you could, just how drinking can affect your oral health.
Alcohol dries your mouth out. When it dries your mouth out, you have a decrease in saliva. So the saliva that normally washes away all the detrimental bacteria isn't doing its job. So now you have all this bacteria sitting on the teeth. Alcohol is also very high in sugar. So now you're feeding the bacteria with this sugar. The sugar produces lactic acid. The lactic acid causes tooth decay. And so it's just a horrible cycle. So when I met Jane, yeah, she had a lot of cavities. We filled those. We got her on a good oral hygiene program to come back every 6 months. And then we had to make her night guard because she just grinds her teeth like nonstop.
Dr. Shea, when you met with Jane, you conducted a sleep study. What did you discover in that study?
She happened to have one of the more severe sleep studies that I had ever seen in my past 30 years of practice. She stopped breathing about 73 times per hour, and the longest episode was up to 55 seconds. Basically, if you do the math, 45 minutes out of every hour, her throat is completely collapsed. So it's essentially a death sentence. Sleep apnea, if untreated, is associated with things like heart disease, heart attacks, sudden death, strokes, cancer, and in women, we know that it's now associated with dementia.
So, Dr. Ashaya, what are some of the treatment options for somebody like Jane?
Well, and fortunately for Jane, our gold standard is CPAP therapy. Basically, it's kind of like a straw of air that's being pushed into your throat, especially the back of the tongue, to keep your throat open. And that essentially can resolve all the issues and associated risk factors. We have other modalities, but she's so severe that the next option would be jaw advancement.
And Dr. Jorge, you discovered something else on the test when you
Yeah, you know
were
what?
looking at her health.
Nothing scares a GI doctor more than an alcoholic coming in saying that they vomited blood. Because you don't know if they have a bleeding ulcer, you don't know if they have veins in their esophagus that have burst. So luckily, there wasn't anything that severe. There was a lot of inflammation with some minor ulcers. But what I did discover was a bacteria called Heliobacter pylori, also known as H. pylori. H. pylori corrodes the inside lining of your stomach and predisposes you to have ulcers or gastritis. But the scary part is that H. pylori predisposes you to certain type of stomach cancers. The sad part, all right, it's good news, 70% of it is treatable. But in her case, if you're still drinking, you can have so many side effects with the antibiotics that are necessary to cure it that it's impossible to take those antibiotics while you are still drinking.
And just as an update with everything that's gone on, Jane was in treatment for about 2 months, checked in August 29th, checked out October 23rd against doctor orders. We obviously invited Jane to be here today, and I know that the three of you stepped up to work with her. And right now, all I can say is I don't really have any other update other than wishing her Godspeed as she works on her sobriety.
It's hard. Recovery is difficult. 40 to 60% of people do fail recovery in the first year, but it's about getting back into it and doing the work, because eventually many people succeed. And so I think we know here that if Jane was to be able to commit herself to the process as she continues, that some of these problems can hopefully be addressed.
You know, I had one really wise old professor in med school that said, try to give your patient just one disease. These are all symptoms. Her main disease is alcoholism.
And I would just say, Jane, if you're watching, we're thinking of you. We are certainly wishing you nothing but the best on your journey for sobriety. Dr. Bill, Dr. Avi, Dr. Jorge, thank all three of you for taking care of Jane.